Hi everyone, my name is Piyush Sanduja and I am the founder of Agenda+Health platform and a graduate of IIT Kharagpur and Indian School of Business. The aim of Agenda+Health is to bring forth the issues of Indian healthcare from a 360-degree point of view with an objective of the future diseases for which India needs to prepare. We are not a superficial podcast when it comes to our presentation, but a science, evidence and insights based podcast. Hence, we would like to cover stakeholders from all walks of Indian healthcare, starting from doctors, hospital owners, startup leaders, medtech innovators, VC and PE investors, business operators, AI technologists, and most importantly, the patients. Our first guest is Dr. Sonam Kothari, who's the founder and CEO of Butterfly Learnings. Dr. Kothari is a pediatric neurologist with a deep passion for behavioral and developmental healthcare. With over a decade of experience, Dr. Kothari brings a wealth of knowledge and expertise to her role. Trained at the prestigious NIMHANS, she holds an MBBS, MD, PhD, and is also a certified behavioral analyst. As the CEO of Butterfly Learnings, she runs more than 50 pediatric neurodevelopmental centers all over India and helps children dealing with autistic spectrum disorders along with other developmental problems. In this podcast, we have not rushed into the solutions but only focused on the problem of autism in India. Why is it rising? What are the scientific and societal reasons behind it? Thank you for watching. So, my first question is what does the latest research on autism talk about?
Autism, as everyone knows, the prevalence of autism has increased a lot.
Yes.
It used to be 1 in 100, 1 in 200, or maybe 1 in 500 even 10 years back. But presently, the prevalence is as high as 1 in 40 to 1 in 60. So,
Yes.
And it's one of the disorders that the cause is not very well known. Like, for example, if you talk about any genetic problems or any infectious problem, there is malaria virus causing
Yes.
malaria, or there is a mutation of Duchenne muscular dystrophy causing DMD. But in autism, it's like diabetes.
Yes.
It's still not known what exactly causes the problem. So a lot of research presently is going on two things. One is the causes of autism, and second, what all can work as a treatment for autism.
Okay.
So,
Okay.
as in any other psychiatric problems, you would have seen schizophrenia or depression. There's a lot of basic scientists working on the what causes schizophrenia or what causes depression, because the brain structure is absolutely normal. Similarly, a lot of work is going on in finding out the biomarkers or the genetic factors or exactly what is different in the child with autism as compared to the neurotypical child.
Okay. Actually, you very well said. My next question included some numbers also. Like you said that 10 years back, the prevalence was 1 in 500 and now today it is 1 in 40, 1 in 50. Like I was checking some US numbers, they said that now it's 1 in 36 is what they said. Um, like, do you believe that it's all genetics? Like, do you feel that like given the environment in India is also polluted, and do you feel that other than genetics, there are environmental factors that are also causing behavioral disorders in children?
Absolutely. Actually, when in the recent years, we have been reading a lot about autism, causes of autism, because when the parent comes to us, they ask why my child got autism.
Yes.
हमारे घर पे तो किसी को नहीं है, हमारे घर पे तो कभी नहीं हुआ है, हम तो पहली बार ये प्रॉब्लम देख रहे हैं, तो मेरे ही बच्चे को क्यों हुआ है?
Correct.
So, to answer those questions, also you need to be sure that exactly what
Yes.
is causing autism. So, I was even surprised that the current prevalence, what they say is 40 to 80% or 40 to 70% of cause of autism is linked to genetics. Now, the only problem is we don't have a causative genetics. We have an associative genetics. That means this might cause, this gene, some problem this might cause. So like that, there are multiple genes that can cause. But there is no causation that this will definitely cause or this will definitely not cause. Like that causation is not there. But a lot of second important reason why the prevalence has increased is something called as epigenetics. Now, one is genetics, that is which is transferred from your parents or in the families
Mhm.
that some of the gene mutations which is coming
Correct.
down to the next generation.
Correct.
But there are some mutations that come in de novo. That means, for example, because of the environmental factors, there are mutations that happens in the genes, because
okay.
of the environmental factor, which can be de novo. That means it just started with my generation, or it just started with the next generation. This is called as epigenetics, and presently a lot of research is also going on epigenetics. That means environmental factors, be it pollution, be it the pesticides in the food what we eat, a lot of junk food we are eating. All these factors actually heavy metals which are seen in the or we are finding in the environment. All these problems are actually causing genetic mutations, which is resulting into epigenetic changes, which are actually causing autism. Again, no proven studies, no definite answers, but yes, genetics, epigenetics, and one more, the first major reason why the prevalence has increased is maybe the awareness, which was not there before. A lot of people have got aware, a lot of pediatricians, even general practitioners who never knew about this problem before. It was like a problem of a super specialty.
Correct.
Now everyone knows about it, everyone refers early, because everyone thinks that early intervention might help the child.
Correct.
So a lot of awareness, genetics as well as epigenetics definitely is resulting in high prevalence.
Okay. No, it makes sense. Like when you see all of these increasing trends, like 1 in 36, and maybe 5 years down the line it will be 1 in 20. Like, do you feel shocked and blown away? Like, what is happening?
Yes, it is. It's a big problem. Presently, I mean, it is actually a big problem because it doesn't really affect only the child. It affects the whole ecosystem surrounded by the child. Surrounding the child. It affects the parents. It affects the society in general. So yes, I mean, a lot of research should happen. A lot of research should work on finding the causes and finding good management or the more evidence-based management for autism. That it should not increase more than 1 in 36 or 1 in 40. I think it should reduce further.
Yeah, I totally agree.
Finding out the factor is very important in future.
Totally agree. Like, what is the current approach of diagnosing autism today? Like, if we talk about India.
So presently, in India, usually what happens is once the child goes for vaccination to a pediatrician, they understand that there is something different in the child.
Yes.
Be it maybe the child is not responding to his name at 1.5 years of age, or maybe the child is not giving an eye contact or responding to what the doctor is trying to tell at 1.5 years of age.
Yes.
And usually the doctor finds that there is something different, or the child is not speaking at all. So they refer usually to a developmental pediatrician, or they themselves think that there is some problem or developmental problem which needs to be worked upon. And they either refer to a therapist, or sometimes if the developmental pediatrician or a pediatric neurologist is available in the city, they refer the child to that specialist.
Okay.
In smaller cities, usually the experts are not available, so they usually refer directly to the therapist if they are there. If the therapist is also not available, then they send them to cities to get themselves evaluated.
Okay.
But this usually works in India. There is very less awareness about the screening tools which a doctor or a pediatrician in their own clinic can use to actually understand the red flags or diagnose the problem early in it. So, for example, there is something called as MCHAT. It's basically a questionnaire which can actually screen the child as early as 18 months and 36 months of age, where you can actually screen. These are just questions which can be filled by the parent or by the doctor, and you can actually screen that these are the problems, and he is prone to get autism or he has the red flags of autism and should immediately be referred to a developmental pediatrician or referred to a therapy center, whatever it is. But I think this is very less. It's not happening very frequently. You should all neurologists uses their clinical judgment and sometimes chat and other clinical psychological screening tools to diagnose autism.
Okay. Is it mandatory that a pediatrician has to screen the child for developmental issues? Like generally, I've seen that if you go to a pediatrician, they are very impulsive in the sense that whatever problems you have, they give you 5 minutes, 10 minutes, and they try and answer your questions. But the focus is on the underlying problem, that the child has fever or something like that. But do you feel that it's mandatory or it should be mandatory?
It's not mandatory, but it should definitely be mandatory because pediatricians are one who is the first contact with the child from the neonatal period.
Correct.
Because of our immunization schedule, what the Indian Academy of Pediatrics has, every child has to go make regular visits to the pediatrician.
Correct.
Even if the child is not having any fever or any cough and cold.
Correct.
Still they have to make regular visits at the schedules which have been designed by the government till 5 years of age. So that means every year or every 6 months you are actually meeting the child and you are seeing the development of that child every 6 months.
Yes.
So it has to be mandatory that it's not about just cough and cold, or it's not, because one is your physical well-being and one is your development. Development is the basics. So and every pediatrician knows about it because they have been trained in that. It's just that with the other focus, that means immunization, cough and cold, or other issues, and a lot of busy OPDs where they have 100 patients or 50 patients lined up for for some other problems. They kind of miss it. But what we feel is because you are the first point of contact, even if you miss it, that's okay. But at least outside, if you can just keep one screening tool where the parents can themselves start screening when they are in the waiting time. And they show it to you that, this is the thing we got and this is showing me red flag. Or you yourself tell your receptionist or you tell your parents that, anyways you're waiting for 10 minutes, 15 minutes. Why don't you just screen your child? It will just help you to get the development in a better way. And it will make life much more easier for everyone. Early diagnosis, early intervention is the key for any of these problems actually.
And you talked about MChat. Is MChat similar kind of a tool wherein parents can themselves screen their child? Like let's say they're waiting outside the pediatrician, and in the meantime they're filling out that form or screening the child, and later on they go and talk to the pediatrician. Is MChat similar kind of a tool?
Absolutely same. It's a screening tool.
Okay.
It's just questionnaire based, and there are some questions there. You just have to answer yes, no, or possible, more frequently, less frequently, the way we do a Likert scale kind of a thing. Very easy question. It's available in multiple languages as well, so that if not English, you can understand in Hindi or Marathi or whichever language is comfortable. We ourselves have actually converted the MChat. MChat is actually designed from the US psychologist. We actually took the rights from her. We converted it to a QR code so that it's all the more easier. You just have to screen it like a QR code, and once you screen it, you get the questions, you fill it, and you will actually get the score that your child is having the red flags of autism or not as early as 18 months to 24 months of age. And that's like the good age to start therapy and actually start working on the child, so that by the time the child goes to school, if it is milder form of autism, they actually can be brought out of it and they can lead a normal life once they start going to school. So I think it's very easy. A doctor or a parent or a preschool teacher actually, or anyone who sees the child daily, like a maid or the caretaker or a babysitter, can actually fill it. It's very easy for.
Okay. And you said that generally we focus on the behavior of the child. Like when you diagnose the child, do you also ask questions related to, say, genetics and environmental factors, or is it just the behavioral issue that you screen the child on, and then later on you diagnose it properly?
It is behavioral, definitely, because autism is actually a clinical diagnosis rather than a genetic diagnosis.
Okay.
So it's like there are few features, that is language delay, language and speech delay,
Yes.
social delays, and repetitive actions or stereotypies, as this called as, like the child continuously keeps repeating some actions or seeing himself or doing this. So basically, some kind of stereotypies that the child develops. So this is very clinical diagnosis. If the child is not making a social interaction, that means not making an eye contact, not giving the name response at 1 or 1.5 years of age, not interested in humans, not interested in human faces.
Okay.
He's okay with toys. He's okay with playing with the non-living things, but he's not at all okay with humans.
Okay.
Or he's delayed in speech. Like, for example, a 1.5-year-old child should be able to speak at least 2 to 3 meaningful words. If he's not able to do that, even if he's not able to do non-verbal communication, like pointing, give me this, give me that. Maybe he's not able to speak, but at least he's pointing.
Correct.
He's pointing to nose when asked to show the nose. He's pointing to fan when asked to show the fan. If that also he's not doing, these are all delayed factors, and this goes towards autism diagnosis.
Okay.
Now, once you get to a clinical diagnosis that yes, he's having mild red flags of autism, or he's having mild, moderate, severe autism, you definitely dig into the birth history. You definitely dig into the age of the parents when they got the first child, because one of the factors presently is high maternal age. All these factors are actually called maybe linked to autism. It's not like they are linked, but definitely they might be linked
One of the
somewhere.
factors.
So so you do ask all these things. You do ask if there was a prenatal, postnatal, natal, any issues in pregnancy, any issues during birth, after birth. So all these things, prematurity is one of the it increases the prevalence of autism if there is a premature baby. So all these things we do ask. We do ask a genetic history, that if someone in the family had speech delay, may not be diagnosed as autism, but he was mentally challenged, was considered mentally challenged, or like पता नहीं पढ़ नहीं रहा था, कुछ करता नहीं है, बैठा है. All these things might be there, so we do dig into all these. If there is a strong genetic history that one or two people were affected with the similar symptoms, or this child's sibling was affected with the same problem, so we definitely ask for going for genetic testings.
Okay.
Even if we are seeing some kind of facial features or chromosomal abnormalities that is pointing towards genetics, that means maybe Down syndrome or some abnormal or different face which we are seeing, which is not usual as compared to the parents who have come. So we do ask for genetic testing to definitely to prognosticate in this child and to prevent it in the further births. So we do.
You said that genetic testing is there a test that you recommend, in the sense, is there a diagnostics test that can be done?
So yes, presently genetics have developed so much that everything has become like a if you have this problem in genes, you should be giving this treatment. So it has become very targeted management. So, but in autism, as I told, there is no particular gene that causes the problem. So you cannot have a targeted gene testing. You do something like a whole exome sequencing, or the whole genome of the child is getting tested for duplications, microdeletions, point mutations, and so on. So everything gets screened, and then there is a complete biometrics analysis that happens. From the literature, it takes the data, and if there are particular genes or particular mutations which have already been reported to cause autism or to be associated with autism, they give you a report that these genes are there, these are deletions or microdeletions are there, which might lead to autism or which is causing autism.
Okay.
Again, it's not like a diagnostic, yes, this has caused autism, but it gives you the clue that might be the cause. So in next pregnancy, we just screen for those targeted genes when the mother is pregnant.
Okay.
So if those genes are still mutated in the other child, we might not go for the pregnancy.
Okay. You also talked about taking the history, and you talk about like the problem can start in utero when the child is in utero. I wanted to understand. I've written it down here. Let's say the child has autism today. What exactly happened when the child was in utero, while the mind and the brain was getting developed? The structures and the cells were, the structure was getting developed at that time. What exactly happened during that time?
When the child is in utero, when the development of the brain happens,
Mm-hmm.
there are a lot of factors, maternal factors, that actually affect the development of the brain.
Mm-hmm.
There are immunological factors, there are hormones of the mother,
Mm-hmm.
there are internal environment due to which gets affected by external factors that might affect the development of the brain.
Mm-hmm.
So, for example, if there is intrauterine infection, which is there in the mother, which usually mothers sometimes don't even understand that there is an infection inside. The uterine infection is there, maybe some symptoms of abdominal pain or something would be there, which would have considered as normal. Okay, it happens, it's pregnancy. But those things, be it infection, be it maternal stress, like the stress due to external environment, be it emotional stress, physical stress, whatever it is, then there is some kind of hormonal changes that can happen in the mother, which can increase one particular hormone more as compared to other. Like, for example, testosterone increases more as compared to the other hormones. All these factors actually causes some kind of immunological markers that gets released in the brain, in the maternal blood, which actually gets transferred to the fetus, because that's the only blood supply the fetus has during that time. And those factors affect the actual neurodevelopment or the neuronal development that happens in the brain. If suppose those factors are leading to more of free radicals or oxidative stress kind of a thing, which is causing damage, there's something called as apoptosis. That means the cell, if the factors increases, the cell starts dying by itself. It's like a normal process in the body. So, for example, if there is some cell which is not useful for me, body releases the immunological factors and kills itself. It doesn't let it grow. So something like that, if it increases more, so like autoimmune diseases, you would have heard. That our own immune system starts hitting our own normal cells rather than abnormal cells. Something like that happens in the brain, and all these factors together definitely causes some abnormality in the development of the child, leading to prematurity, leading to autism, leading to any other developmental problems in future.
No, I wanted to ask this question because I've seen that parents generally feel it's a behavioral disorder, in the sense that it can be cured. Like, do you feel it can be cured? If, let's say, if the problem happened in utero, then do you feel it can be cured, or you just can give tools to parents to manage it?
Good part of the problem is it does have some micro level changes that happens in the brain, but macro level or structurally the brain is normal. It is not having any, like if I scan the brain or I do MRI of the child, it's absolutely normal on a cross level. There are internal neuronal changes or the pruning changes or something that has happened that has caused the problem. So it's a neurodevelopmental problem. It is curable or not? No, I won't say it is like it's a personality that gets developed with time. So it will always be there in you. But if it's a milder form, if it's mild, it is diagnosed early, and you give good behavioral intervention from the start. At least we have seen that we have almost discharged more than 80 kids with us who had come very early. Definitely, they have come 2.5 years of age, 3.5 years of age. Took therapy for 1, 2, and sometimes 3 years continuously, and we are able to discharge them. They are living a normal life with neurotypical kids, going to school, competing with them, going to national level skating competitions and so on, and absolutely no difference as compared to the other child. Maybe they are a little introvert. They might not have 100 friends the way other person might be having, but it is not. It is like a personality. It doesn't look. It's different. But if the variety is more moderate or severe, I would say it's always there. But the problems might change. So, for example, at the early stage, it might be speech and language that is affected. In the adolescent stage, it might be more of dealing with relationships, talking in public, making friends. All those things might be the problem. Dealing with your physical changes that are happening big time in the adolescence, and with when they become adult, it might be all the more different behavioral changes and all. But you might require help for these kids even at an adult stage. If the disease is severe and moderate, they can become independent, but they still require some help, maybe a push, because problems at every stage is different. You would have treated the problem at less than 10 years of age, but 12 years problem are different, so you might require help during that time as well. So this is the kind of a spectrum. Yes, they can be discharged, but sometimes they can be dependent for life.
No, it definitely makes sense. Like, let's say if the problem is in utero, and we know that maternal health is very important, and let's say if the families or women are planning to conceive or they have just conceived, do you feel that they also should be given proper recommendations, during that conception time and when they are planning to conceive? Should they be given recommendations? Like, should the, I would say, should the therapy, or in the sense, should the discussion start from that point?
Okay, and I think many of the gynecologists, obstetricians are doing that now. So, nowadays there's a lot of pregnancy yoga, pregnancy, that's something called as Garbha Sanskar.
Yes.
They do. That means good thoughts that's put into the into like good thoughts, spiritual reading, spiritual talking. All these things actually affects your mental state, and this actually needs to be stressed by your obstetrician or whoever is getting consultation, the consulting doctor, because I remember when I was expecting, my in-laws were actually, they were very specific that this 9 months, no stress will be given to her. Even if they won't like something which I'm doing, or they won't like, there were differences in opinion, they didn't tell a word, because they were very particular. The stress and they are educated, but they're not doctors. But they were very particular that stress in this time might affect the baby's temperament or baby's growth. So I think this is very important, that the stress level in pregnancy, good thoughts that you can have in the pregnancy, and moreover, any problem that is called discomfort, which we consider as normal, chalo hota hai, pregnancy mein hota hai, may be linked to some infection which can be treated.
Correct.
These all things should be taken given more importance and treated early, so that these problems don't happen in future.
So it's safe to say that as far as awareness in doctors is concerned, as a society, we need to not just target the pediatricians but also the gynecologists.
Okay. Absolutely.
Okay.
And the common man who is actually having the pregnant lady in the house.
Correct.
Should also make sure that this awareness should be there, that these all things now cannot be screened in prenatal testing. You do sonographies, you do multiple sonographies to check that the baby is growing well or not. This is one question they come up with. हमारा तो sonography हुआ था, हमने 3 बारी कराया, हमने 5 बारी कराया, कोई anomaly नहीं निकला था, तो मेरा बच्चा ऐसा कैसे निकला? So these are things which are internal. Externally, you don't find any abnormality, which needs to be told to the common man that you need to understand these are all the factors that internally affects the baby and should be taken care of during the pregnancy.
Okay. No, my point was that for all these serious issues, you go to a doctor. they are your trustable source of information. So from that point of view, I think pediatricians and gynecologists, both of them matter.
Absolutely.
Okay.
Absolutely.
Okay. And like you have said that the mother's immunity and overall health also is very important. Um, like it leads to a better brain development of the child. Like this was my next question, but you have already answered it. And like nowadays, a lot of time I talk to my friends who have kids, and both of them, husband and wife, both are working, and they say that like the lifestyle is also very not healthy, I would say, because like let's say both of them are working for 12 hours, the fooding habits are also such. Do you feel that these lifestyle issues also add up and lead to the delayed development of the child? Like let's say initially there was nothing, but between 0 to 3 years they were not able to first note the behavioral changes in the child. But do you feel their own lifestyle issues can also lead to slower development of the brain?
Pregnancy or in general prior to the birth, definitely it plays a very important role, because what you eat, what age you deliver, how is the I mean, what is the impact on the food, be it pesticides, be it the oil, be it heavy metals, we don't know anything. The more you take it from outside, it does cause some of the epigenetic changes in the in utero, which affects the development of the child once he's born. But after birth, maybe 1 to 3 years of age, many times it is said that screen has caused autism, or because I was people working a lot of time, they were on screen, maybe phone, maybe television, and that has caused autism. That's, I won't say screen causes autism. It just definitely increases the severity of autism.
Okay.
But it's a cycle. That means I got addicted to screen just because I was not okay socially. I didn't want to be social. I was a little, away from humans. I don't like being social. So I like being stuck to screen. Because I like getting stuck to screen, I all the more stopped being social because I was getting my, entertainment, my source of happiness from my screen. So I stopped talking all the more. There is something called as virtual autism that happens just because of the lack of stimulation. That because of the continuous screen, you didn't give him a good stimulation for language, and that's why there is a delay in learning language and social skills. But the moment you stop the screen, they start learning, they start picking up, and they become neurotypical with time. But there is a less number of group, less amount, but the majority of them they have a predisposition, they already have it in them, the feature of autism is already there, which actually led them to not be social, which actually caused screen addiction, and that increased all the more the symptoms of autism.
Okay.
So,
okay.
Yes.
No, it makes sense. Another question. Let's say, do you feel there is some stigma also? Let's say parents have noted there is some behavioral issue with the child. Maybe it's anger, maybe it's social anxiety. Do you feel there is some stigma in parents also to come out and talk about it, or maybe discuss it with the pediatrician, or discuss with other parents?
There's a lot of stigma actually. Majority of the parents, first of all, they don't understand only that this is a problem. They think that with time it will be fine. हर बच्चा ऐसे ही करता है, हर बच्चे ऐसे ही behave करते हैं, कुछ बच्चे लेट ही बोलते हैं, that is fine. हमारे घर पे सब बच्चों ने लेट बोला है. तो first of all, acceptance is itself not there that there is some problem. Even if someone else is telling that there is some problem, there's a lot of stigma. Even the relationship between that two people also gets spoiled. कि तू मेरे बच्चे को ऐसा कैसे बोल सकता है? How can you tell me this?
Correct.
He's completely fine. You are just overjudging him. So there is a lot of stigma. Even when you go to a pediatrician, one of the problems that happens with the pediatrician is the stigma. Because the moment, even if pediatrician is understanding that there is a red flag, if he tells it to the parents, parents get like, no, this doctor is bad, he's just judging our child, and we should not visit this pediatrician even for an immunization next time, because he is the wrong doctor. So that's why for them to label that the child is having a red flag is so difficult that they first say, I can see some problem. Better you meet a developmental pediatrician because he would be a better person to tell you because he's qualified as a developmental pediatrician. So if he says, they might agree.
Okay.
If I say, they might not agree.
Okay.
So even if the doctor is saying the parents are not okay to accept, they change doctors. There is a lot of doctor shopping that happens. That no, इसने बोला है autism, मैं इसको दिखाती हूँ, शायद ये नहीं बोलेगा. So and it is not just parents, but even the neighboring people, they will start seeing the child differently. The acceptance in the society presently is not that great, at least in India. They are not accepted well. So all these things does create a lot of stigma within the families.
For this podcast, I have just one last question as far as problems are concerned. Last question is that, yes, there is stigma from parent side, and there could be cases wherein the pediatricians also noted some behavioral issues, but they didn't delve into it because of that stigma. They felt that they might lose out on the patient, and they might lose out on the future business. So they also stayed away from openly talking about it. Now the next intervention should happen in school then. Like when I was in school during our times, like I didn't know anything like this exists at that time. Do you feel that schools are changing? Today's schools are changing, at least in tier 1 cities. Are they changing? And if they're not, then what should they do?
I think this is a very good question, and preschools are actually changing.
Okay.
They have become much more aware as compared to any other. Even I would not say the schools, the preschools are more aware because they are the first people to actually take the kid at 2.5 years or as early as 2.5. Nowadays, preschools and that play school starts at 2.5 years of age itself. And because they have a reference of so many kids with them, they actually can pick up the differences very fast. They can understand, oh, ये अलग बैठता है, बच्चों में नहीं रहता है, ये बाकी लोग तो सब सुनते हैं, मेरा ये क्यों नहीं सुनता है, ये कभी जाता ही नहीं है बच्चों में, कॉपी नहीं करता है, अपने नाम को रिस्पॉन्ड ही नहीं करता है कभी. And they usually guide the parents. Many of the times they guide the parents that ये अलग बैठता है. Videos, they send videos that your child sits alone. He doesn't mix with others. I think there is some problem that is there, and you should meet your pediatrician. They either will suggest to meet a pediatrician or they will suggest developmental or pediatric neurologist if they are aware of them. But once they have that thing that something is wrong with the child, meet your pediatrician and tell this problem to the pediatrician. Pediatrician also will see it better because already someone has pointed out this. And preschool is one thing where the child spends a lot of time, 3.5 hours, and they are able to observe him in general. For one day you might not judge, 1 week you might not judge, but if 6 months the child is behaving the same way, they definitely have a thing that इतना time नहीं लगता है adjust होने में, क्यों इतना time लग रहा है. And they are playing a very important role. Lot of referrals to a developmental pediatrician or a pediatrician comes from the preschool. Correct. So if not pediatrician, preschools definitely should be aware. If they are aware, well and good, but there should be awareness programs that are there for the preschool so that they diagnose it.
Okay. So actually, these were my questions for as far as autistic problems are concerned. Like next time, probably we'll talk about the solution side and what you're doing. But I just wanted to touch upon the school that you have opened, Bliss. Would you like to talk about it? How is it different from other schools?
We opened our therapy part in around 4 years back. And there were many parents with us who were with us for 2 years, 3 years. But the parents of severe or moderate diagnosis, with the kids who had moderate or severe diagnosis. Their concern always used to be, हमारा बच्चे को स्कूल में नहीं लेते हैं. They don't allow the child in school because either they have behavioral issues or they don't speak or they just don't want to take care of the child or they ask for a shadow teacher. कि आप भेजो लेकिन एक को साथ में भेजो, साथ में बैठने के लिए. हम ध्यान नहीं रखेंगे, वो जो भी रहेगी वो उसका ध्यान रखेगी. So that was a motivation that we should start something for these kids. And second very important thing is there are special schools. I'm not saying that there are no special schools in India, but the problem with the special schools is few of them do follow a curriculum, but many of them don't follow a particular curriculum. So like for a neurotypical school, you follow first standard, second standard, third standard and so on.
Yes.
Like that, there has to be some curriculum for special need also. That after this, what I will be doing. After this, what the child should be doing. That type of curriculum is not followed by majority of the special schools, and they just put the children in one group. Be it better, be it very severe, mild, moderate, any level, they're all in the similar classes, and everyone is given the same program.
Yes.
So which we were not okay with, that a good child should be able to become better. A severely affected child should go to a moderate level or milder level with the schooling. So we thought of something which is like an inclusive schooling system, where the kids who are actually in the moderate, severe or milder forms, they get the curriculum based on their capacity or capabilities. And if the child is neurotypical, just having speech delay or just having behavioral issues, they should be just be with us, learn the behavioral part, learn the speech part, and do the normal education the way other kids are doing. It should not stop them from a routine education. And that's how we thought of starting an inclusive school. We did start it in the center first, but then we realized once it started in center, it becomes more like a special school.
Yes.
Because you are in a center which is running for special need kids. So this year we initiated something which is within the routine or a neurotypical school. So it's a school in school where their kids, they might also have kids who are lacking in academics, who are just having behavioral issues in class because of autism or because of ADHD diagnosis, or even they might be having a low IQ. All these kids we will take care of. They will come to us as in a resource room. We will teach them the academics, they go back to the routine class. We will teach them behaviors, they will go back in the routine class. We will work as a shadow for them and then fade off with time. But they be in the normal class where they are already in. And the kids who are lower on IQ, who can actually not do the normal class, their intellectual capacity is not enough to do a regular schooling. We run the school with their design curriculum in the same school, so that they come to the same premises but learn the way they can learn it better. And we run a bliss curriculum there. So this is the motivation, that it should be inclusive. It should be together. The neurotypical and neurodiverse kids should be able to see each other, meet each other, understand, learn from each other, and grow together. And so this is our first inclusive school in the school, and let us see, we'll be opening more with time.
Very nice, very nice.